So at this time, I will turn the meeting over to you, and I'll let one more person in. And Candace Anderson, the floor is yours.
Okay, well, thank you all very much. It is wonderful to be with all of you, and I'm looking to see if my screen is sharing properly. Are you seeing? It's not showing up. Here we go. Let's see. There we go. Okay, so I'm going to whip through a lot of different information and absolutely ask me questions. You've got a lot of experts in the room also, with both Bob Campbell and Rusty Watts. When we come to some of the impacts of COVID, they might be better to talk about. I see my colleague John Phillips is here when I'm talking about Cicera, so lots of great experts. So hopefully all of you are familiar with the coronavirus.cchealth.org. This is the place to go for the latest details, some really excellent dashboards that are very, very helpful in analyzing where we are right now. Now, these are yesterday's numbers. It gets uploaded every day at 11:30, and I did not have time today to redo all of my slides. But as of yesterday, you know, we had 101 in the hospital, 102 deaths, and our total case count for the county was up to 6,425, a cumulative number. Yesterday, we had 152 new deaths, and we do also show recovered cases, which shows, you know, really there are about, 1,300 or so active cases. But as you can see, excuse me, I have a very sensitive mouse who likes to jump ahead. As you can see from down below, you know, we've really dramatically increased our case count just in the last 30 days. And it really has been quite surprising to many of us who really felt great about how we had all flattened the curve. We had done our shelter in place, and we had a timeline, and we were moving forward, and things were going to open up because nothing was quite as bad as everyone was saying it was. So one of the most important things we look at is the infection rate. Now, obviously, if we're doing more testing, you're going to have more cases. So what's really relevant to us is, well, what's the infection rate? And what, in fact, are the hospitalizations? And of course, very sadly, the deaths. So as of yesterday, we were testing positive about 6.3% of those cases that we were testing. A month ago in June, it was about 3.5%. And we did reach a peak, a milestone at the end of June when we went over 8%. And that was what we had put in an attestation to the state, where we said, we're comfortable moving a little bit faster. Once we hit that 8%, it was disconcerting. Anything over 5% had our health officers concerned about how widespread this is in the community. And so this shows you the number of cases and shows you case by location. I'm trying to get our health department to start showing historical data as well, so you can just see the sharp contrast. But as I've compared it, you know, communities even such as Alamo, Danville, San Ramon have increased more than 200% just in the last 30 days. And as we do the contact tracing, as we try to identify where did these cases come from, we're finding primarily that it's been gatherings. It has been, you know, whether it be a family gathering, whether, you know, potentially a protest, church gathering, whether it be people just saying, I'm done, I don't want to deal with this. It's not typically been contracted by people who happen, they don't think, but by people, you know, who happen to be at a store with very short-term exposure to other people. As we move forward, and my screen decided to freeze. Hospitalization data. And this is something else that has been pretty significant looking forward, or looking backward to where we are now. To be where we are today, of over 100 people in the hospital, is surprising. You know, back at the peak in April, where we sort of thought we were really at the top of the number of cases, we were down in the 40s. So right now, we look at this hospitalization data, and fortunately, there have been a lot of improvements in how you treat patients in the hospital. Not everybody who's admitted ends up on a ventilator. They found drugs like remdesivir, some kind of basic asthma drugs, steroids, as being very helpful for individuals who have certain, or showing certain symptoms. So that's something we continue to watch and track carefully. And then we go to look at the ICU data. And this is brought from the state as well, but essentially it shows us that, you know, we've got about 132 of about 260 ICU beds occupied. And this is not occupied by necessarily COVID patients. In fact, as you look at the graph up here, it shows you the top left of there are 101 just positive patients, and then of that 39 in the ICU. The other ICU beds are occupied by people with strokes, heart attacks, you know, other things that you would expect to see in an ICU. And so this shows you our ICU data. It has remained relatively stable, so to speak, with a few peaks and valleys from back in April. So right now, while we're concerned about a surge in the hospitals themselves, ICUs right now are able to handle it. The concern really is, will those cases, after they've been in the hospital for a couple of weeks, go south, where they will end up in the ICU? And we, of course, are seeing this in other parts of the state, parts of Southern California, Imperial Valley, where as part of our mutual aid, we have had maybe 4 or 5 patients from Southern California showing up in our hospital bed data. We do not have anyone from any of our state prisons showing up, but we've also learned that we probably at any given time have about 15 Contra Costa residents who are patients in Alameda County hospitals, particularly those in West County. Often will end up in Kaiser and Oakland, where they're treating their COVID patients rather than Kaiser Richmond. Similarly, they might end up just at an Oakland hospital if they're coming from San Pablo or Richmond, where we do have a lot of the cases right now. So who is getting sick? And this is a helpful analysis when we look at by race. Hard part is we don't have a complete picture, because when you get tested, you're not required to state your ethnicity. And so we have a very large unknown. From this data, you do though still see blue shows confirmed cases, green shows the percentage of the county population. We still right now are showing an overrepresentation of those who are Latino, or Latinx is the common term right now. And so we have been doing more and more outreach in those communities. Historically, it's been Richmond, San Pablo, the Monument Corridor. And the reality is, these individuals generally who are living in these communities may not have had the luxury of working from home. They could be frontline workers, grocery store workers, cleaners in hospitals, whatever it is. Oftentimes these individuals might be in a family, in multiple families in the same home, or they just did not have the information provided to have them follow precautions. So that's who's getting sick. And then as we look at the age group, this is where, and I'm sure many of you have read this, we're seeing one of the more surprising trends. Initially, people who are getting sick were older people, people over 50, people over 60. And now as you look, and this is not a complete apples to apples comparison, because back in June, they were just doing 20 or under, 30 and under, and now we've broken it down into a little bit greater age groups. But by far the largest group of people are 19 to 30-year-olds who are contracting the virus, 31 to 40-year-olds. And while they may not have the same symptoms that cause them to land in the hospital, they nevertheless are passing on that, and they are passing it on to those who go and work in our long-term care facility, to their parents and their grandparents. And it's a novel virus. None of us have immunity to it. And so some in that age group are having very, very severe reactions. So it's nothing, you've read about these COVID parties where fraternities or others think it's a great idea to see who can get COVID first. It's not a great idea. Lives have been lost as a result of it, and it's been spread to many others. And so here, the death data, we have a little bit more specificity, because when someone does pass away, we are able to capture that for the most part. Mostly, it has not been those who are Latinx who have passed away. By far, it's been people who are Caucasian who have passed away, and certain level of African Americans, but still below the county population. So we're not seeing in our deaths, as they are in other parts of the country, a disproportionate representation of people of color who are dying. Age of those who are dying, and this is again, older people are dying. It's the reality. And so these charts have been really helpful. Back in June, we were at a much lower volume. We were measuring, under 15 deaths. Now we're over 35. And it has been, primarily people who are over the age of 70 who are the people who are dying. But you still have, 20 people 50 to 70 years old, sort of a demographic some of us might be familiar with in this room. People are dying, and we aren't able to have that broken out by, did they have any pre-existing condition? Did they have some other reason? What we have had our health officers explain is the primary cause of death was COVID, and that's what appears on their death certificate. So it's not like they died of cancer, but they tested positive for COVID. This must be a COVID death. They're assuring us that the primary cause of death is what is being listed. And so those, at my request a few weeks ago, we started breaking out is who's dying in the general community as opposed to those who are connected with a long-term care facility. So on our dashboard, you now see new deaths by day. The beigeish green color, those are people who are associated either as a resident or someone who works at a long-term care facility, have passed away. The blue is the death data with regard to someone in the general community. Actually, today's dashboard, I did take a quick peek. We do have another new death, so we're actually up to 103 deaths, and that individual was at large in the community, was not associated with a long-term care facility. So of course, there are state orders and there are county orders. And early on, we were saying if a county order is more restrictive, it applies. And now as the governor continues to make more of his own orders, if a state order is more restrictive, it applies. And it's the way that it has been interpreted. And so we've got a series of active health orders, many that have superseded the original orders. And right now we don't have an end date on most of our health orders, simply because we don't know when this will end. Early on, we were saying, everyone's going to shelter in place until April 30th and then until May 30th. We've taken those deadlines out because we just don't know when we're going to be at a point where we can lift further restrictions and things like face mask requirements. So I always like to say, who's issuing these orders? And it's Dr. Chris Farnitano, and we, the Board of Supervisors, appointed him back in July 2018, and little did we know at the time what he was going to have on his hands. He's a great doctor and well-trained at Duke University. He's been with us since 1991 and has background not only as a family physician, but as an HIV specialist, which is very helpful because of the infectious nature of our disease and some parallels in the AIDS crisis, AIDS treatment to what we're going through right now. And as I like to mention, our health officers in the Bay Area were kind of marching in lockstep in the early days. They still talk several times a week, and they're still trying to have as consistent orders as possible, recognizing that if something's open in one county, people will just gravitate over there. And right now, the outlier really is San Mateo County, although they are getting very close to being on the governor's watch list, which then would compel them to be following some of the other health officers in the Bay Area's orders as well. And so people often say, well, how did you cede that authority to him? Why are you letting him do this? Aren't you the Board of Supervisors? And so there are, in fact, 2 California Health and Safety Code sections, and the first 101040 allows when an emergency is declared for a health officer to make any orders they deem necessary to address this state of emergency. And then the second section is 120175, which is essentially saying that anytime they're aware of an infectious communicable disease, they have the authority, they must take measures as deemed necessary to prevent the spread of the disease. And so that's where his authority comes from. And as I mentioned, we did early on back in late May apply for a variance as we started to open outdoor dining, as we started coming up with this timeline of reopening, applied for the variance, pretty much attesting that we thought based upon the trends we were on at the time, we would keep our case counts, case percent positive below the 8%, that we would have stable hospitalizations not increasing by more than 10%, a whole variety of things that I'll go into greater detail in a moment. And we moved forward with great confidence. I was feeling really good about this. I really thought we had this. I really thought, you know what, everyone sheltered in place, they did the right thing, and as we open things up, it's just going to, keep sort of level. And of course it didn't. So Bay Area health officers, they had their own indicators, and we still use these in our county as we start looking at when will we start reopening again. Right now, we're not planning on reopening anything simply because we're on an uphill climb as opposed to a stable or declining. And so we looked first at total number of cases. Hospitalized patients is flat or decreasing. So both doubling in the last month, we're not there. Sufficient hospital capacity, as I explained, we do have that, even though we have higher, triple the hospital numbers we had a month ago. Sufficient COVID-19 viral tests conducted. We're now able to conduct close to the 2,000 that we want to test. State says a minimum of 1,500 a day. The challenge, of course, is that the tests and the reagents you need to process the test are in short supply because there is such significant demand both in California, the United States, and globally. And so we are really addressing that. So that's where we get to our sufficient contact tracing and isolation quarantine capacity. We're still tracing close to 90%. We have 135 on board, working hard, but it's still, if you can't get your test results back for 14 days, it's not going to do you a lot of good to at that point approach someone because they've had the opportunity to spread it if they were asymptomatic. Hopefully, anyone who gets tested who is exhibiting any symptoms will have the sense to stay home and try to isolate themselves from other family members or household members. But that's not always the case. And so we are working very, very hard to come up with alternative labs. We are buying more lab equipment for the county labs, but we could only process it if we get the chemicals we need to process them. And our commercial labs that are doing the bulk of our drive-through testing sites are really, really impacted, and they don't have a lot of expanding capacity. And so, we're looking at, are there other test mechanisms? And there are some interesting tests that some of which have not yet been approved by the FDA, but saliva tests where you can get an instant result, possibly at home in a matter of minutes, things like that, that would make life much, much easier in our ability to assess whether anyone should be going anywhere or if they should be in fact staying home. And we, as I talked about, at least the 30-day of PPE, we're there. So the state has their indicators to put us on a watch or monitoring list. And they have this formula that addresses our population for a 14-day period. If it's greater than 100 per 100,000 population cumulatively over a 14-day period, then you're in trouble. And we're right now, we're averaging right now 109.6, although the last few days, when you look at our 7-day average, we're closer to about 140 cases just for 7 days. Test positivity does not exceed 8%. And last week we hit 8.2. Right now we're in the 6.1, 6.4 range. Percent in 3-day average of COVID hospitalized patients does not exceed 10%. We're, although we spiked, we still are below that 10%, although they do cite that if you look at the hospital monitoring list, they do cite our high level of hospitalization as one reason they want to keep us on the list. And then the ICU beds and ventilators, which again, we're doing pretty well with. So we had this really fun timeline, mapping out how things were going to open before July 1st. We ended it on June 29th, which I remember well because it happened to be my 60th birthday. And what a way to spend my 60th birthday getting a call from the health officer saying we're not moving forward, we're in trouble. So this is a great graphic that we do have online showing what is open, what is closed. We are now allowing hair salons and barbershops. On this one, it has an X, but as of today, there's now a check by it as long as they're doing it outside and you're not doing hair color, you're not doing shampooing. Someone just shows up and gets their hair cut. And right now, we had not opened nail salons and tattoo parlors, other things like that before the state shut down our hair salons. So we are not yet opening those up, but the health officers are looking at that very carefully. So these are the things that the governor shut down a week ago Monday, and that was the hair salon, barbershops, indoor malls, indoor places of worship, or protests, indoor protests, and realizing that yes, most protests are not indoors. Some are if they come to my Board of Supervisors meeting, which even if we're not there, we have had protesters show up. But there's been a real push by many of us to say both are important, protected First Amendment rights. And both the right to protest, the right to free speech, as well as the right to worship. And so it's been very important that we don't favor one over the other. And I think there was a feeling by many that we were allowing these protests as much as you can allow a protest to go forward, but trying to really constrain religious worship. And so I think the governor's order and our health code order, our health officer orders in Contra Costa, we're trying to have that consistency. These things on the bottom half were also banned by the governor, but we had not yet opened any of those because we had slowed down just a couple of days before he put an end to these things for now. And so we still have a lot of people with a lot of questions about the health officer orders. We love to direct people to the FAQs, the frequently asked questions that are updated daily, or call our coronavirus call center. And they have trained individuals who know the rules, and if they don't know the answer, they get a health officer to provide that information. Free testing, we're still doing free testing with or without symptoms, but giving priority to those obviously who are hospitalized, those who might be first responders, those who are healthcare providers. We are no longer doing the deep brain scrape that you're seeing me receiving in this picture. We're now doing a very subtle inside your nose. You take the swab, you scrape on inside. And we've got locations for COVID testing all over. You just need to have an appointment. Sometimes our call line is really impacted. I have made appointments always when I've had 2 tests now. One was the sort of the press conference one, and then after I had been out of the state, concerned about any potential exposure I might have had, because I have actually, as we speak, my daughter-in-law is in labor at a local hospital, and I've been caring for her 3 children who fortunately are at their other grandmother's house at the moment, so I can talk to you. But nevertheless, I wanted to make sure I did not have COVID. I will say it was very easy to get tested, but it took 13 days to get my results back. And that is very, very troubling. We really are working hard on addressing that. Congregate care facilities, absolutely, this is the worst scenario we've seen in any of this crisis, and not just here in California, but in Massachusetts, other places where this is where so many people are dying. And so we've had a very robust testing program in place. Total so far in our county, as of yesterday, we've had just under 500 cases, 71 hospitalizations, and this is a cumulative number. This does not reflect in the number of hospitalizations that I was telling you before that are just over 100. A few of the congregate care facility individuals may end up in the hospital, but more often than not, because they're in a skilled nursing facility or they're already receiving treatment, they will not be transferred to a hospital. They can receive treatment where they are. And then deaths, very sadly, we have had 71 deaths. And so when there isn't an outbreak, I'm going to give you some bullet points of what we do. Immediately, county health or our healthcare partners, who would be John Muir, Kaiser, Sutter, any of the other hospital medical groups, send in a strike team to review infection control practices with the facility staff, which I will tell you, they've all been trained well before then, but to try to identify, is there something that's not working that might be allowing the infection to spread? A mobile testing unit then goes to nursing homes, does the on-site testing. Testing is done even before there's an outbreak, as I mentioned, where on at least a monthly basis, there is testing taking place. And there's a lot of surveillance testing, which means they're going in and just doing random testing of individuals just in case someone is asymptomatic and may have the COVID virus, but not know that they do. And so currently we have 15 active outbreaks, 10 resolved outbreaks, which means the outbreak is over, but that's still a lot of outbreaks, and it's a challenge for our first responders, who then have to make sure they know which of these facilities have one if they go in to transport a patient. We also have quarantine periods. If you were to transfer from one skilled nursing facility to a lower level place, you would have to be quarantined for 14 days in the new facility, even if you tested negative. So here's some more this shows you the graphing, sort of the chart of where we've gone, of how high it's gotten, showing those 499 cases. Another kind of a congregate care facility is our homeless shelters. And we have done really, really well to not have outbreaks, large part because we did move people out of our homeless shelters early on into motels using some great state grant money, Project Room Key, that allowed us to do that. We have 559 homeless individuals and families within that group currently housed in these motel rooms. They're not just given a key, but they are managed by one of our providers who provides homeless services, so that they have meals, that they have someone who has a key, checking up on them, making sure that people are complying with whatever requirements are required. We also, in a lot of our homeless encampments, at the request of cities, installed sanitation stations for hand washing and restrooms. And the point of that was, early on, is most people living in an encampment weren't inclined to want to move into a structure, and they were sort of like a household, and we wanted to sort of keep them contained. And so our core workers are regularly going out there, our community outreach engagement teams, working with those individuals to offer them support they need. If someone does come down with it, we try to help them. In some cases, we'll in fact put them in one of these motel rooms so that they can isolate and try to recover and not end up in a hospital. So this just shows you homeless cases in total that we've had, 65 and one new one yesterday, total 1,800 homeless tests to date. And then other big congregate care facility in the counties are county jails. So we have not had an outbreak. And this goes to the credit of county health early on, sitting down with our Sheriff David Livingston, came up with a whole procedure. One, which I'll talk about in a moment, is obviously reducing a lot of prisoners who both the district attorney, the public defender, the court, and the sheriff did not feel posed a significant risk to the community. But they had a procedure where anyone who was booked at intake was quarantined for 14 days. They were given a medical exam when they came in, they were tested, and 9 cases were identified while they were in this quarantine period. And they were, all 9 were ultimately released. Their crimes were not significant enough. They needed to be held. And so there are no COVID positive inmates currently in our jail. We have had a couple of our deputy corrections officers who have come down with it. We've done immediate tracing to make sure that if they came in contact with inmates, but even inmates are wearing masks, and it's my understanding that the inmates themselves get kind of on each other's case if someone isn't masked. So we're very fortunate. We're not having the Santa Rita jail, Alameda County experience or the San Quentin experience. So who's in jail, who's letting out? And so early on, Dave Livingston was nice enough to sort of give us this breakdown. And right at the beginning, it dropped, bookings per day dropped 84%. And typically they were having 60 per day. They were down to 10 per day. Now it's rising. They're probably closer to 15 to 20 because criminals are feeling a little emboldened and doing bad enough things that they do need to not just be cited and released. So this is a list a couple of months ago, actually, of who was still being held. Murder, child molestation, rape, kidnapping, robbery, some burglary, assault with a deadly weapon. And so we've been very fortunate that we've followed some really good procedures early on to avoid those outbreaks. There's still a large call to release everyone from the jail and stop, killing them in there. We're not. So moving on. So we continue to really say, this is what's going to stop the spread. Social distance, cover your face, enhance your hand hygiene, wash your hands often, carry hand sanitizer in your car, wherever you are, and stay home if you're feeling any symptoms, whether it be a little scratchy throat, a cough. We just really need to continue to slow down the spread. So I'm going to shift to a few other county issues. Census 2020 is...
Supervisor,
yeah.
Thank you, Madam Supervisor. I'm going to pop in now before you move on to the census,
Okay,
so you can answer a couple of the questions that have come in.
sure. Let's do COVID questions before I move on.
Yeah, pretty much they're very simple. Are the ICU units overwhelmed by COVID cases, or can they handle it?
Right now, they can handle it. Less than half of the ICU beds in Contra Costa County are occupied. And of those, only I think about a third or even a fourth of those ICU beds have COVID patients in them. So right now, we have the capacity. But because we have seen our hospitalizations just shoot up in a 30-day period, it is nevertheless making our health officers very concerned that we could start surging into our ICU beds as people who are hospitalized aren't getting better and they're going to need more dramatic treatment.
Okay, I did a couple of quick numbers calculations here, and I'm not a numbers person, but from what you provided, I calculated we've got upwards of a 98% survival rate in the county, which I think is very encouraging. And I would say keep up the good work. I mean, deaths are always to be avoided, and we don't want to see anybody suffer, but I think that's very encouraging moving forward. We have a question: are the 18 to 39-year-olds symptomatic?
Some are, some aren't. And so primarily people who in that age range are getting tested are either those presenting symptoms or those who, as part of contact tracing, are identified as part of a household where it's popping up. But certainly, yes, they are, the one group that is not showing symptoms is children under 10. But no, 18 to 39-year-olds are definitely showing symptoms, but not necessarily having a severe reaction of those who are over 60 years old.
Okay. The next question is, previously the purpose for sheltering at home was so that ICU units were not overwhelmed. With hospital now under 50%, now the parameters have changed. Why?
They continue to change just because we continue to learn more about how the virus is spread. And the fact of the matter is, while we sheltered in place and that worked really well in containing it and flattening the curve, once we started opening things up, we're starting to see a new surge that has our medical professionals very, very concerned. Again, most aren't seeing it just because we've opened up businesses, which is a good thing. They're seeing it really. I was on a call this morning with a doctor who practices down in San Ramon, and he just identified it as COVID fatigue. People are just saying, I'm done with it. I'm not going to take these precautions. I'm going to invite my whole family over for Father's Day, or I'm going to have that graduation party in my backyard. And so we still are very, very concerned about the level of community spread and the fact that our hospitals could very quickly get overwhelmed, just as we've seen us go from, in early June, having maybe, excuse me, I'm jumping too fast. My computer just wants to keep doing this. I apologize. And it doesn't even want to go back. We're going through this. I apologize. I'm gonna see if I can get this all back. Yeah, it's escalated so quickly. That's where people are very concerned.
Okay, I'll try to run through these before your PowerPoint races off without us.
I apologize. I don't know what it's doing. But
okay. Is there an estimated time frame for reduction in test waiting times?
There's not an estimation. It's simply a matter of continuing to ramp up what supplies we can get. And so we have a logistics team working in county health out there trying to purchase, whatever reagents they can, trying to line up contracts with labs that are not already being utilized by other commercial providers, trying to build that capacity internally. That's the constraint. The constraint isn't us being able to go and actually perform the tests, and we want to encourage people to still sign up for those. It's just finding and then finding new ways to process them. I'm sure many of you read earlier today about this bundling concept where you get 10 to 12 test samples, you bundle them together, isolating a sample of each of them, If they come out all negative, you don't do any further testing. If it comes out positive in the bundle, then you individually test each of those 10 to 12 swabs. So we're going to have to keep looking at those, and also pushing the FDA to approve other methods of testing that are reliable, because testing is going to be so critical to continuing to just open things up, do that contact tracing. When you look at countries where they've been successful, I think Singapore is one example where they were able to, as soon as someone had symptoms, isolate that person, do that contact tracing, and they've had a very, very low spread through the community. So it's challenging. I don't think it's too late. I will say too, with testing, we are starting to do a little bit of antibody testing just in general in some communities where we had a higher incident right now, some West County communities. And as they've done the antibody testing, just to sort of see how widespread it is, it's coming back. Less than 3% are showing that they in fact have COVID. So we're still very far away from the concept of herd immunity, which is what some people thought was going to be the panacea. This was going to solve all our problems. Not so much. When you looked at Sweden, they still ended up in probably worse shape. But it's ever changing. That's the challenge with this. It's also new, and none of us have immunity to it.
How many cases are needed to call it an outbreak?
You know, as soon as you have, there are different levels of outbreak. And so it's color coded. And so they have yellow, orange, and red. And so as soon as you have one case, it's starting. And by the time you have two, I think it's deemed an actual outbreak that starts to be color coded, and they immediately swoop in and start doing that additional testing, that additional work with that facility. And the challenge is that it spreads very, very quickly, particularly when you have healthcare workers, despite wearing, the PPE they need to. It has spread much quicker than anyone could anticipate, despite the best efforts of many of these very qualified healthcare providers, highly rated facilities.
I've got a couple of questions asking about administrative fines for not wearing a face mask.
Sure.
And there's also, that researchers think that talk a little bit about wearing masks.
Okay.
And your reaction to some Southern California jurisdictions that are putting out some pretty steep fines for not wearing masks in public.
Yeah. Well, so we are actually on Tuesday at our Board of Supervisors meeting going to be looking at whether or not to establish administrative fines. And this is not, as we had our discussion about it 2 weeks ago, it's not that we're envisioning fining people who are not wearing masks. Enforcement would be up to each city, each jurisdiction. It really was a tool for enforcement of businesses who weren't adhering to the health officer's code, sort of a fairness issue where, some businesses would say, I'm going to open up regardless, too bad, you can't get me, try to shut me down type of thing. And we have our district attorney office has an enforcement unit that has been working on this in conjunction with local police officers. And really they felt like we needed something that wasn't a misdemeanor. If you violate the health code, it's technically a misdemeanor, which entitles you to a jury trial. It's a very, onerous process for something that's fairly mild. And they said, we just want another tool in our belt that would allow us to encourage business owners, individuals to comply. Whether none of us envision, marching and sending a police officer into someone's backyard and counting how many people are back there or who's wearing face masks. For the face mask thing, I get so many videos, and I have of different people saying, no, they don't work, they don't make a difference. Most recent science that I have been reading shows very clearly this is spread by droplets. If you are wearing a mask, it's not to protect you, it's to protect the people around you. And the chances of you spewing your droplets on someone within, 3 to 6 feet of you is far less if you have a mask on. And so I'm a big supporter of masks, and I've got my lovely mask that I wear when I'm going out. And to me, it's something, it's a courtesy, it's common sense. And I get that some people don't like it, but then stay home and don't infect anyone else. And I mean that in the most gracious way I can. But everything I have read shows it's going to help slow the spread if people are wearing masks. So I don't know if we pass this ordinance, it really, I don't know, a single police chief in Contra Costa or our sheriff who wants to go out and start citing people for wearing a mask. They've been friendly, they have done education, and it's really for, you know, like I said, a business who sort of says, well, I think I'm gonna open my tattoo parlor, and too bad, I know it's against the law, but I'm gonna do it anyway, and then you would have an administrative fine that could be issued as opposed to charging them with a misdemeanor.
Okay, one last question before we move on to the census. If 70% of deaths are in congregate centers now, has that changed over time?
It has been, it's gotten, I don't know. I was going to say, I think it's been fairly consistent, but not necessarily in the early days. And that would be an interesting thing to continue to track. And you actually could go to our dashboard because most of our little slides allow you to sort of hover and go back in time. And so one of you who loves doing things like that, go back and do it. But it has been fairly consistent that 70% of our deaths have been people over the age, you know, of 80, and similarly tied to a congregate care home. But also, you know, early on, we had far fewer cases of young people. We didn't think young people could get it. Well, they can, and hopefully we won't see a larger surge in deaths in those younger areas, younger categories as well.
I lied. I have one more question, and I think it's important because we're very concerned at CoCoTax about our small businesses and the economy in this county. And 30% of small businesses probably won't reopen. And the longer we keep them closed, the higher the number. So when will a 1 or a 2% caseload be acceptable, or when can we roll out an opening of the economy?
I think what we have to do is we will need to get off the state's watch list. It will be one thing. And then as we see our case percent positives, you know, going below 5%, when we see our hospitalization numbers either stable or decreasing, that is when I think our health officers are going to want to open more businesses. You know, I'm grateful that we were able to get as many businesses open as we did in June, where it wasn't just, you know, showing up at the door retail. You know, all retail businesses you're now able to shop inside. Governor's talking about coming up with new restrictions next week. Hopefully it's not going to be shutting down all retail stores. Hopefully we're going to be able to let, you know, small businesses get all their employees back in, even if they are not essential businesses. But again, like I mentioned at one point, our tracking and our tracing really isn't showing people are getting it by shopping as the customer. Where we are unfortunately seeing, you know, a few outbreaks are in businesses, particularly where it's more of a production manufacturing type business where people are very close together, and it's hard to conduct that business without that taking place. But from day one, with Chris Farnitano, I've always said, you know, can you get an economist in the room too, when he was marching in lockstep with the health officers, because we all knew from day one, it wasn't that for every day we were shut down, you know, it was going to be 10 to 20 days of recovery. And yes, small businesses were going to be impacted. And I, who do not like rent control, I don't like moratoriums on eviction, I supported one for small businesses because I felt it was that critical to give them that little buffer of time to work something out with their landlord. As I talked to most commercial landlords, they have been extremely accommodating to every one of their tenants because they need to. They know this is temporary. They know eventually they will open up. They want to work with them, and they even put their tenants in different categories of, you know, types of tenants: those who can pay, those who can't.
Okay, moving on to the census finally.
Okay, and I'm going to get my slides to be in order. Yeah, census, if you are all such conscientious citizens, I'm sure you've already filled out your census. If you haven't, please do. You should have received something in the mail, or you could go online to do it as well. And as I'm out talking to groups, I just talk about, yes, it's in the Constitution. It's how we distribute federal funds. And really, we look at, as we've done the math for Contra Costa County, where we administer so many state and federal programs, we can lose up to $2,000 a year for each person who is missed. And of course, it helps shape our communities. So next year, we will be looking at redistricting the Board of Supervisors, State Assembly, State Senate, congressional seats, all of those things. So it's important to do that. Supervisor Burgess has been great heading up our census committee. I serve on it with her. And our Contra Costa County response rate is 71.2%, which is the second highest in the state of California. So we're pleased that people are doing that. We're well above the California response of 63% and the national response of 62%. Black Lives Matters. This has been an interesting time, and I should have popped in a slide. As some of you may be aware, I had a protest at my home yesterday, not just over Black Lives Matter, but over the funding of the sheriff, over essentially, it was a message of defund the sheriff. I had about 32 cars come out from West County, circle my neighborhood, come out, make speeches on my driveway. And unfortunately, I was presenting to the Kiwanis from 12 to 1, and then I was going to a COVID ad hoc meeting at 1 o'clock. So I was not able to engage with them, but they were there as my home cameras exhibited. They were very respectful. But we've been doing a lot in Contra Costa, and we will continue to, all of us on the Board of Supervisors, fully support the need, the importance of racial equity. We've done it through our racial justice oversight body, where we've really looked at the disproportionate representation of people of color in our criminal justice system. And it's not just because you've got bad cops, it's what happens going back to the individual's childhood, what opportunities did they get for diversion or for another form of way to give back to society than just being put in juvenile detention. So that's something we continue to work at. We have a racial equity action plan. We have a juvenile justice coordinating council that's looking at these same racial equity issues. A hiring outreach committee in our county, every department head is required every year to look at the racial and gender composition of their offices, identify, compare that to our county population. And if they're deficient, if they, for example, have an overrepresentation of white women in their department, but an underrepresentation of Hispanic males, they then are supposed to come up with a plan that shows how they're going to try to equalize that, so that our offices are supposed to represent the diversity of our county. The sheriff's department does not receive military grade weapons or vehicles. And we have been working for several years on de-escalating crisis events, whether it be our mental health evaluation teams that go out with officers that are trained to help deal with crises, help families in the aftermath of a mental crisis in their family. And then we actually work with Seneca, and we have mobile crisis response teams. We send them out through 211 as well as through 911. We have our sheriff deputies take 32-hour crisis intervention team training, implicit bias training. And as I stated in a written report to Cron that was covering yesterday's protest, I said the majority of us on the Board of Supervisors fully support these concepts, but we don't see them as being mutually exclusive to supporting the sheriff. We don't think you should defund the sheriff in order to achieve some of these very important objectives. And when I say Black Lives Matters, people are often concerned. I'm not speaking about an organization, because I'm aware that there is an organization with a certain agenda. Just the concept that racial equity is very, very important, and that Black lives do matter to members of the Board of Supervisors, as they do to all of you. And in keeping with social justice, we are having our annual Truth Act Forum, which will be this Tuesday. And this is a requirement by state law, as California moved to be sort of a sanctuary state, where we are required once a year to have the Truth Act community forum. And this is an opportunity for our sheriff or any other county department that regularly interacts with ICE to make a presentation about every interaction they had with ICE that year. And then the community is supposed to, ask questions, make comments as a report to the Board of Supervisors. We are working through that. I had a lot of angry people this week who didn't like the fact that we started at 9:30 a.m. and last year we did it at 1 o'clock, the year before at 2 o'clock, and some are angry that we're not doing it between 4 and 6 o'clock. We had to notice it 30 days ahead, and they didn't start telling me they didn't like the time until about a week ago. So it was too late to change it at that time. We'll see what Supervisor Burgess does next year. But it is an opportunity. If any of you feel like weighing in, we will start at 9:30 a.m. and you may virtually join us. Next that we have going forward is a big discussion about whether or not we should retain the ranch, the Orin Allen Youth Rehabilitation Facility out in Byron. This is for youth who commit fairly minor crimes. Currently, we have 13 boys housed there between 13 and 15, about $11 to $13 million in needed repairs. And as we continue to look to our alternatives to incarceration for youth, diversion programs, restorative justice, we're hopeful that we'll continue to see what has been a national trend of a much lower trend of juveniles engaged in the juvenile detention system. Huge outpouring of community. Now, the same people who want us to shut down our juvenile detention facility in Martinez are demanding that we keep this one open. And we also have a lot of people who have volunteered out at the ranch who are saying you're taking away this opportunity. It's going to be part of a much larger discussion. It was supposed to be part of our budget discussion. It still might be, but I may be removing it for a different venue because I think a lot of the issues are worth exploring even deeper. We do have a new chief probation officer who is fabulous, and she is supportive of us closing the ranch, but we're going to continue to have her dialogue and how she thinks we can best assist the young men and young women in our community who have the unfortunate circumstances of finding themselves engaged in our criminal justice system. So budget is available online, and I think Bob and Rusty could talk to this too. I'm giving you just a short snapshot of what we're looking at. This shows you our revenue sources. So we've got just under a $4 billion budget. And so largest part is our intergovernmental revenue, our hospital health plan revenue, which of course is, we've got a county hospital, we have county health clinics, we administer a lot of programs. Then intergovernmental revenue, we do administer over a lot of programs. And then you get to miscellaneous revenue. Taxes currently make up just under 12% of our funds for our overall budget. And then as you break it down to, you can see sort of our appropriations where we go. And so bulk of what we spend in our budget does go to health and human services, law and justice, the sheriff, the district attorney, the public defender, the probation, jail, all of that makes up just over 14%, and then general government is just about 16%. And so we're anticipating very robust hearings. Again, a lot of people who would like to see us defund the sheriff. And it's interesting to note that as a county supervisor, we don't have the authority to dictate to a department head how they spend their budget. We can approve their budget, but we don't have this line item veto power to tell them you can do this, but you can't do that. It's what we're having an internal discussion about that, but we are a little bit limited in that. So people have asked about our Corona aid, the relief, economic security. We are getting, well over $200 million in aid to how we're going to respond. And Bob could speak to this very well of how meticulously we are detailing each and every expense, how it is coronavirus related, whether it be lost revenue from services we're not providing, or whether it be just the outright cost of services. And then there's also some FEMA aid that we may also be able to be reimbursed for a lot of our response to COVID. And so here it's actually I said 200, but over 250 million COVID response. This sort of is a breakdown of other counties who are also going to be receiving this funding. And we have to file again, I think David Twa was supposed to file one this week, a very detailed list of where our expenses are going to as we seek to utilize this funding. And then we also, our cities are getting some COVID CARES Act funding. And so this is good because they were sort of turning to the county saying, hey, you've got all this money. We want some too. You know, we know we're going to, I don't want to say blow through it, but just our response has been so profound to this emergency, to this disaster, that we know we will be utilizing that full $250 million. And so this is sort of a breakdown of some of the funding that cities are now eligible to address their response to the crisis. And then we move down to
before you go further, I've got a couple of questions before we go too far out there.
Okay.
The juvenile facility at the
the ranch.
Byron Ranch. 11 to 13 million for 13 individuals. I think CoCoTax is probably going to say that's over $1 million per youth. Isn't there something better that we could do rather than spending that kind of money for what's currently just 13 individuals?
Right, and those are repairs to the facility. That doesn't include the cost per youth to supply the services. That's why it's the county administrator proposed putting this into the budget. And yes, absolutely. And our new chief probation officer has identified how at our Martinez facility, we can replicate the same positive programs where you can have, you know, open bedrooms, not cells for them, open classrooms, the ability, there's better visitation with families, reunification. There are a lot of very positive reasons why we should close the ranch and have those individuals who are such low-level offenders back in that facility, or better yet, if they're that low-level offender, are there community programs we could place them in that would be far less costly, and we would not have to continue to staff the ranch. And so that's part of the dialogue that we're having right now about it.
Yeah, why was it allowed to get so bad?
It's just, well, it's an old facility, and it's just deferred maintenance, and it's, you know, there are changes in ADA requirements, lots of things. I mean, you can still, it's not a dangerous condition, but when you look at long-term, you know, maintaining it to the standards it really needs to be, that's what the estimate was coming in through our county administrator's office of how much it would cost to bring it up to the code it should be. You know, there have been other suggestions. I was on a juvenile justice call the other evening about, well, you know, couldn't you use it for low-level offenders from all over the Bay Area? Because so many of our counties are just shutting the doors to our juvenile detention facilities. And you also have, on top of that, the state is now starting to close their state facilities and saying, hey, counties, why don't you, we're going to let you take over this responsibility as well, which typically those offenders would be a much higher level offender and would not be a good fit out at the ranch. So it's part of a big discussion, but yes, we're all very, very cognizant of when you've got less than 15 boys out there, you're not going to spend that kind of money. And there have been a couple of grand jury reports looking at the ranch as well over the years. And so lots to discuss.
Yeah. Okay, go back to your thing. We'll have a couple of last questions before you have to sign off, but I'll let you finish. And here's maybe part of our question on Cesara.
Cesara, it's great. So as John Phillips will attest, you know, at the end of December, we were at $9.4 billion. We had a net pension liability of, you know, just under $1 billion, which is really, really good, and 89.3% funded. We still have our assumed rate of return of 7%. 2019, our annualized rate of return was 14.6. When you look at the past 3 years, 8.3%, past 5 years, 6.8%, and for the past 10 years, 8.5%. So status of Cesara during COVID. And so this was, I contacted Tim Price, who is our chief investment officer, and I said, okay, I realize, like any of us who look at a stock portfolio right now, it's just one little flash in time, but this is sort of what he gave me. I said, so tell me, how bad did things get? How bad are things right now? And so he said, well, of course, we had the $9.4 billion fund on December 31st. End of March, we were down to the value of our portfolio being about $8.4 billion. We now, mid-July, went back up to 9.1 billion. And again, you know, the market is going up and down. And of course, we're very diversified in Cesara, but we are anticipating in the next few weeks updated valuations for a lot of our private equity, private investments, and we anticipate we'll see some losses there. So that's the snapshot with that. And this gives you sort of a historic look at our actuarial funding status of where we've been and where we've come. As you can see, you know, in fact, I go back to, you know, 2012, when I joined the Board of Supervisors, we were down, you know, 70, 69% even, and now we're up closer to 90%. So in 2018. So we've made a lot of progress, and as John can attest, we've made some really good decisions that bore very well in this most recent crisis, where we've really ensured that our investments are diverse, but we also have the ability to have the liquidity needed. So when the markets crash as they did, we don't have to sell things off at a loss. We're able to have a revenue stream that is sort of separate, that we had ready and able to we keep making the payments without finding ourselves in a really precarious situation with regard to having that liquidity to do that. Revenue by source is always interesting to me, probably to you also. The sort of the turquoise color shows you what employers are paying, the county, the fire districts, the special districts. What is in the aqua, light aqua, that shows you what plan members pay. And then the green is more what our net investment income is. And so fortunately, we have some good investment advisors. We've been making some good choices. And so the bulk of the revenue for Cesara continues to be investments, but we're very, very cautious, and we have a board that is just has a slight majority. And Rusty, I've talked about John, Rusty's on Cesara with me too. Rusty can attest to this too, and they can both weigh in, but we're pretty conservative in what we want to do with that funding. And then this gives you just a snapshot of how we, you know, allocate our assets. So little blurry, and I apologize, that we've got global equity makes up about 27%, high yield is just 2.2%, private equity 11%, private credit 5.8%, real estate with value add 1.7%, real estate opportunities distressed 5%, real estate investment trust just under 1%, risk parity just under 5%, risk diversifying 7.8%, cash overlay 2.2%, liquidity, which is sort of what I was talking about earlier, that 21%, domestic equity 11%. So we have a very diverse portfolio that has continued to sort of help us get through us. Who knows where we'll be in another 30 days, where the market will be, all of these markets will be, but it is a diverse portfolio, which is very helpful rather than just having all your eggs in one basket. And the other thing that's helpful, because I know you're concerned, as I've always been concerned about, you know, skyrocketing, you know, pensions. And yes, there are outliers, there are no questions, but this gives you sort of the average benefit payment that Cesara is making is just under $4,000 a month is the average payment. And obviously some people are making far less and some people are making far more, but this just sort of gives you a snapshot of how much is being spent on the pensions. And then I'm going to just jump really quick. Toll lanes, 680.
Let me stop you there real quick, because I know we're short. Questions have been coming in about the pension liability. With the announcement of Dave Twa's ending of his contract, it was stated that there's an unfunded pension liability of about $667 million. Now, that certainly doesn't seem to jive with what Cesara is telling us. I actually had tried to get the public information officer from Cesara to speak with us, but they were too busy. So I'm hoping you can shed some light on.
And I don't, you know what? I did not put that number in. And is that in the application?
It was in the article from I saw it in the patch and in the Times.
Yeah, and I don't know where that number came from, and I'm going to ask Rusty or Bob. Do either of you know where that number came from?
Are we referring to the 670 million? Or the
the 670 million. I don't know who threw out that number. I don't know. Do you know where that comes from?
I believe that's the county's portion of the unfunded liability.
Oh, that, you know what? And that would make sense. Thank you, Rusty. Yeah, because the county, of course, we're just one plan member, and then we have several fire districts as well as Central San and others. So that, thank you, Rusty, the smart man in the room. That would make a lot of sense, because given that we're under 1 billion, that would make a lot of sense to have that be the county's portion.
The other question on here was that the investment advisors, are we investing in anything from China, and have we considered disinvesting with Chinese sources?
You know, we probably are, just because we have so many different places we invest our money. In the past, we have avoided identifying areas to divest from, whether it be fossil fuels, tobacco, things like that. You can spend a lot of money just watching that, you know, just monitoring that, having someone track, oh, wait, you know, this fund, you know, has this tiny amount in this. As far as I know, and I'm going to turn to Rusty and John Phillips, I'm not aware of any of our investments that are based in China, but it's very possible that funds we're invested in have some business with China. Do you know, Rusty?
I don't.
Okay.
That's,
John?
Neither do I. No, I don't ever recall us discussing that specifically.
No, and we have discussed, because people have come to us and said, we don't want you, you know, investing in this industry because we think it's evil and bad. And we've just really avoided that politicizing of the fund because we don't know that it's necessary. Now, if there was a reason where we felt it was not financially sound to invest in China, of course we would not. But right now, I'm not aware of, even in our foreign funds specific to China. We could certainly find out, but we have not sent a group to go do some due diligence in China because we're going to invest in a large factory there or even in a fund over there.
One last one on that, and then I'll cut off the Cesara questions. A quick count on the budget numbers in the presentation shows a 22% increase in the last 4 years. How does that compare to the combined effect of population growth and CPI inflation factor for a reasonable budget increase?
I couldn't tell you. Obviously our population has not increased that much, and I'm going back to our budget. A lot of it comes out of different programs that we are now passed through to us, and whether it be state or federal programs, and that's probably where you see the most increase. Our general fund, which I don't have the slide up for that, just in the interest of time, you know, shows far less discretionary income, and that we're not seeing. And that usually does come much more from our property taxes and local revenues. That's not going to change very much, and we're not seeing that change. Mm-hmm. So,
yeah. And sorry to have to ask you so many questions on Cesara, but since we can't get anybody from Cesara to talk to our pension,
we have us here, and Deborah used to be a Cesara member too. We'll let her chime in also.
Yes, she's welcome to. But I do have one more question that I think is important. What sort of investments make up the liquidity piece on the investment chart? Are those short-term bonds or what?
It is a whole mix of different types of investment opportunities. And I don't have it off the tip of my head. I'm going to turn to John, who sits on our finance committee. John, off the top of your head, do you want to sort of spell out with our liquidity some of the types of investments that are made up of that?
Sure. We have something like 3 firms that we use. They specialize in very short-term fixed income interest type investments. I believe one of them uses, well, I guess that's too much into the weeds, but they have very short duration, if you're familiar with the use of the term. They are as close to cash as we can get, still getting some income. Typically the income runs somewhere between 1% and 2%. But the reason for having it is that we would not be put in a position where we had to sell hard to sell good long-term assets to make benefit payments. So we have about 4 years of benefit payments in the liquidity piece of the now $9+ billion.
Yeah, thank you. This is why I have this great panel of experts next to me. So thank you. but absolutely, as John pointed out, we would have been in a world of hurt had we have to start liquidating just to make our payments when we plummeted in value back in March. Okay, any other CESARA related questions? I'm just gonna pop on. I know a lot of you hate our express toll lanes, but I'm gonna tell you about them anyway. So we've got southbound lanes that are being completed right now. They're gonna open a year early, and this is 680 leaving Martinez, heading all the way down to Walnut Creek. And so it'll be completed in early 2021. And initially, they're not going to be open to tolls, or it's really going to be just carpools. And they're opening them up that way, primarily because we're a year ahead of schedule, in large part because people were not on the roads, and the tolling equipment is not ready to be installed. And so will be those who have a carpool. Electric vehicles, once the tolling goes into place, also are going to start being on all Bay Area tolls, paying a fee, and it'll be about a third to a half of what the toll would be for other people. But so those of you who purchased your Tesla thinking you could just zoom up and down the express lanes, you're going to have to start paying a little. So that's an interesting part. We're working on the northbound and trying to complete the lanes coming up. For any of you who've had the misfortune of trying to leave Danville or even Walnut Creek at 5 in the afternoon when we still had traffic. And so we're working on those. Big challenge with that is these wonderful BART poles that are just really in the way. And so they're looking at some design alternatives that actually would include having the northbound lanes take up one of these southbound lanes, and then moving the southbound lanes over here and over to where the off-ramp to 24 is, and then potentially expanding out in this area for additional capacity. But if you want to weigh in on this, if you're a fabulous designer, we've got virtual open houses for you to provide feedback before July 29th. You have 5 more days to do it. And it's called innovate680.com. It's one of the best virtual surveys, feedback I've participated in. Really, really good. And I'd encourage you to go in there and do that as we look at completing this express lane, improving the traffic along 680. Countywide half-cent sales tax in November. Well, I'm not a big fan. Surveys are showing that, about 32% would support a 20-year half-cent sales tax. And about another 27% said, yeah, I'd probably support it. And so based on that polling, my fellow supervisors are looking like we're moving toward putting that on the ballot in November. It would be a general tax. We're not identifying what the tax would be used for, although in narrative, it's, everything from, first responder services, social services, homeless services, essentially all of the work that the county does. It would apply to all. It would be county-wide, and the entire county would get to vote on it, but we, the Board of Supervisors, would be the one deciding how it is going to be spent. However, because some of our cities are already at their sales tax cap, Steve Glazer is bringing forward a bill, SB 1349, which would allow the sales tax cap to be increased, or in essence for certain taxes not to be counted against a city for their sales tax. Needs 4/5 vote of the Board of Supervisors to put it on the ballot. We would have to do that in August, and we'll see. We're going to have some discussion about it on Tuesday. And I always say my office is still there to serve you. I do have it staffed daily. Dom Pruitt, the young man who works for us, loves being in the office. He answers my phones most days there, and most of us are working very, very, very hard remotely from home. The volume of emails we're getting during this crisis has exponentially jumped, and we're always happy to respond to those. And I'm sending out weekly COVID updates on what's happening. If you're not getting my updates, you should be, and you need to email my office and let me know. So that is my presentation. And now I'm happy to take any more questions, even though I've gone on and on and on.
You may now take a quick breath. I would we're very aware of the half-cent sales tax increase that's been proposed, and we're very grateful and impressed that you were the sole no vote for it going forward. Could you explain to us why you did vote no and why you think it should not go forward?
It is one of those things where now is not the time to be looking at taxing people. You know, sales taxes are the most regressive form of taxation. All families are reeling under the impacts of COVID. I don't think it's time for us as the county to be saying to individuals, give us your money, we'll take care of you. We'll take care. It's not the right time. As you know, there have been times past where I have supported a sales tax, and a very specialized, very narrowly defined sales tax that, for example, for roads and improvements to transportation, and there was a very high level of accountability. I'm not a big fan of just general taxes, because I've got to be able to say to my constituents too, this is how you're going to benefit from it. And I'm not sure what has been thrown around as here's what we might spend it on is really going to be of significant benefit to my constituents in District 2. So that's another reason. But I think when we are in a pandemic, when we are doing really extreme measures like moratoriums on rent and evictions, to throw a sales tax on top of it is just, it's not the right time. And I think it's very tone deaf to be doing so. So that's, in a nutshell, my feelings.
Thank you. And basically we agree from what we've had our discussions about so thus far. I know you have a time constraint. Is this your time where you need to?
Well, interestingly, I will just say I got a text that my 7th granddaughter was just born, 8 pounds, 8 ounces, literally two minutes ago. So I'm just delighted to say Lila Jane Anderson has just joined the family.
Congratulations.
Well, thank you. Thank you.
Applause, applause. So I would expect that this is the time that you probably need to get off our line.
If you don't mind, I would
fully
love
understand.
Feel free to forward questions to me if you have any.
We will. And I want to thank you very much for your time. Congratulations to you and the family. And we'll look forward to speaking with you again soon. Thank you so much.
Thank you. Okay, bye-bye.